Medical marijuana. What is all the buzz about? Coming up now on Toronto Speaks Addiction. Hi, I'm Dr. Vera Tarman and welcome to Toronto Speaks Addiction. Tonight we're discussing how marijuana can be used medicinally. Is it safe to use? How much is beneficial? What about addiction? Joining me are Dr. Nachim and Dr. Schecter, both physicians who work in Toronto medical marijuana clinics. We are here to answer your questions about the use of medical marijuana. Who should or who should not be using it? How much is actually safe to smoke? What are the side effects? When is it addictive? Whether you're the one using it or worried about someone who is, please give us a call. So, medical marijuana. Dr. Schecter, why don't you tell me, like, as a physician, that seems like an oxymoron to me. So why don't you tell me what medical marijuana is? And how is it different than recreational marijuana?
So if you take a bag of marijuana and you put it on a table, there's absolutely no way of knowing whether it's medical or if it's recreational. It's really how it's approached.
Okay.
And we don't like to use the word marijuana. We actually like to use the word cannabis just because that refers more to the plant. Marijuana has a stigma associated with it.
Okay.
But medical marijuana is marijuana or cannabis that's used just like we use any other medication, for a specific indication, for a specific outcome, in order for patients to achieve a certain benefit, a benefit that is identifiable, that we can often measure, and use it in such a way that will improve their quality of life.
Okay. Well, let me ask you a question. When the way that you're describing it, it makes me think that like the opium plant is, obviously it's something that's natural and it's grown, and then we make it a medication. I think part of the confusion that doctors have is that it's not being somehow transformed. I mean, we have the drugs, the sesamet and nabalone, but right. Here we've got this substance that looks like it's like growing from the plant itself. So that's probably somewhat confusing.
That's true. So at our clinic, the Cannabinoid Medical Clinic, we actually approach this topic, instead of looking at it just as medical marijuana, we actually look at it as an entire therapeutic class. Instead of looking at it as medical cannabis, there are numerous options within that therapeutic class. You had mentioned a medication called nabalone, also by the brand name Sesamet, which is a cannabinoid. It mimics some of the properties of herbal cannabis. There's other medications that are available on the market, such as Sativex, which is a spray that you put on the inside of your cheek. And then there's herbal cannabis, which is also a cannabinoid. And it's much more complex than just than just nabalone. Nabalone is a single chemical that's synthesized by man, whereas herbal cannabis is actually a very, very complex plant. It has hundreds of chemicals in it.
Okay. Well, I would imagine, Dr. Nachim, that patients are probably more interested in the herbal variety than in the medication variety, wouldn't you say? And why is that the case? I mean, we've got the medication that you were mentioning already.
Well, it's, we see, at our clinic, we see a wide range of patients. So we have a lot of people who come in seeking cannabis. And, for various reasons. But a large part of my day is also convincing patients to try cannabis. They've tried conventional treatments, they've tried multiple pain medications, very strong narcotics, and nothing's working for their pain or other ailments. And that's when we consider cannabinoids, and especially the cannabis plant, as an alternative. We try to encourage them to use nabalone, but sometimes it doesn't work. I think part of the problem is that we're talking about a substance, a plant, for which, for most of its history, its recent history at least, it was illegal to do any studies on it. So that we know very little about it from any kind of benefits that's been documented. So we just don't have a lot of research. But we do have a lot of patients who are reporting that it does help them. And in recent times, we were starting to finally get some small trials.
But don't you think that it would make more sense before physicians prescribe it that we get more research? because at this stage of the game, we're being asked to prescribe. We don't know what we're doing. We don't have very much research.
And I think where we are right now is that doctors in Canada, we've been given that responsibility to prescribe marijuana or cannabis to our patients. And a lot of patients coming to us are already using cannabis, and we have to be able to handle their use. And this is where I think as doctors we're not doing a good job with cannabis users. Just to tell someone to stop using, even though they're reporting that it's helping them, or stop using even though they might have an addiction. So I think it's our role, and that's how we got started in this area to begin with.
Yeah, I would imagine that you would see yourselves as specialists, because a lot of the GPs are going, I don't know what to do, but...
That's right.
Yeah.
So we like to refer to ourselves as cannabinologists.
Oh, really?
And I say that a bit tongue-in-cheek, but we like to roll with it.
Yeah. Oh, gosh.
So we actually do see ourselves as specialists because even though we're family physicians, we've created somewhat of a niche for ourselves within general practitioners. Most physicians, as you mentioned, really aren't comfortable with the notion of medical cannabis. They're not comfortable with dosing or titration. They're not comfortable with the potential side effects.
Yes.
And even more strikingly is they're not comfortable discussing medical cannabis with patients. They're not familiar with the terms to use.
Yeah.
They're also not familiar with the legalities and how to go about allowing their patients to access herbal cannabis if they find that their patients are good candidates. So with that in mind, we created a clinic that really specializes in assessing patient suitability for medical cannabis. And over the past year and a half, we've received over 4,000 referrals from local Toronto physicians.
And can people just self-refer? Like, can somebody in the community say, I'd like to try medical marijuana or cannabis, and just
No, we really encourage our patients in general to speak to their own family doctor or specialist to bring that up as an idea, because if they come to our clinic without having spoken to their own family doctor, it silos care. It basically creates two parallel approaches to the same patient that might not be the best thing for the patient. So many patients come to us because they don't like the side effects of opioids. The vast majority of our patients are chronic pain sufferers. Many of them are on opioids, and many of them want to decrease their opioid consumption because they hate the side effects, they hate the way it makes them feel. And if we prescribe medical cannabis with the idea of decreasing opioids, and they haven't spoken to their own family physician or prescribing physician, how will they know how to counsel their patients to reduce their opioids?
Now, Dr. Nachim, how do you know when somebody, even somebody who's referred by a family doctor, is legit? Like, maybe they're just telling their family doctor, I've got chronic pain, but really they just want to get high.
Part of our process and what we do as physicians is we do a proper history, and we look at their story and their history. We look at their medical documentation and any imaging that they have, any specialists that they've seen. We have a discussion a frank discussion really about their use and when they started using, other drugs that they've used in the past. We look at any psychiatric risks, any other risk factors that they might have. And throughout that conversation, it usually comes out, and we, I think from our experience, we can tell if, and a lot of times, it's not, we don't usually see the occasional weekend user. They're not coming to our clinic. We usually get people who are either regular consumers or are interested in looking at trying cannabis as a mode of treatment.
So you're saying that the recreational, you're not likely to get the guy who wants to just get the legit version. We've got to go for a break in a second, but...
So we've started seeing them a little bit more frequently, I think, because... Okay,
I'm going to just ask you to hold on for a sec. We'll be right back after the break with more help on Toronto Speaks Addiction. Welcome back to Toronto Speaks Addiction. I'm Dr. Vera Tarman, and joining me today are Dr. Nachim and Dr. Schecter. Today we're discussing medical marijuana and the safest way to prescribe it. So Dr. Nachim, you were talking about, well, I was trying to get at this idea of how can you avoid the recreational user with their story because they just want to get the legitimate marijuana to, versus the legitimate.
So I think one of the things that we do at our clinic, and this is what from our experience that we developed, is a way to manage cannabis users. A lot of people will drink alcohol, and we have in society a recommendation of safe drinking limits, and we know when someone's a problematic drinker, as physicians we know these guidelines, and even when they meet a criteria for an alcohol problem.
Yeah.
For cannabis, we don't have as much experience in this. A lot of physicians don't have as much experience in this and treating patients. And part of what we do is to categorize patients in that spectrum and try to figure out where they lie. And a lot of patients will use cannabis for medical. They start using it for recreational reasons when they're young usually. Over time they get a medical problem of some sort, and they start using it for that purposes, and then they might become habitual users, and a certain population will become addicted to cannabis. So we deal with that whole spectrum, and it's just a matter of figuring out where they lie on that spectrum.
So let me ask you now, I'd like to really know, who would you say is a candidate and who should not be a candidate?
Our typical patient has a chronic medical condition, whether it be pain-related from neuropathy or musculoskeletal or post-surgical. They might have a gastrointestinal problem or a neurological problem.
Yeah.
Often they have been living with this problem for several years. They've tried a number of medications, but those medications have often been ineffective, or they have had intolerable side effects.
Okay, so what you're saying is that people with lower back pain or chronic neck pain from an injury in the past or digestive issues, irritable bowel that just can't be managed, they would be candidates?
Absolutely.
Okay.
But not if they haven't tried at least 1 or 2 or 3 first-line therapies. So cannabis is not a first-line medication. It's not something that we are going to be prescribing for everyday back pain. Obviously, you're going to try Advil, Tylenol first. If patients have failed those medications, and if they've failed other potential non-interventional or interventional approaches, then we will consider one of the cannabinoids, either a prescription cannabinoid like Nabalone or herbal cannabis. Now, before prescribing, we have to make sure that they're not at risk of having some negative consequences of using herbal cannabis.
So what kind of risks are we talking about?
One thing that we're very careful about is prescribing to youth, and that is under the age of 25. We know that youth have a greater possibility of having cannabis use disorder or dependency or addiction to herbal cannabis. They tend to use more cannabis with less concern for its potential safety and the potential consequences on its life.
Okay, so you wouldn't start somebody who's under the age of 25?
Not unless they have really exhausted all first and second line approaches.
Right. What about somebody who has been smoking, they're 30, but they've been smoking all their life? Would you continue them on?
It depends what the issue is. So, as Dr. Nachim has mentioned, many people have a history of using cannabis in their youth. What we see very commonly is people in their late teens, early 20s tend to use cannabis quite regularly, recreationally, and then once they grow up, they stop using it. Maybe they'll continue to use it socially or at a party here and there, and then they'll get a chronic condition. And they'll use herbal cannabis and they'll say, oh my gosh, this actually works. And they're comfortable with it. They understand how it works, they understand the effects, they're not scared about it. So if they haven't been able to get control of their symptoms using regular medications, and they have that experience, they've been using it before, that is definitely a patient who is a potential candidate for herbal cannabis.
Okay. Now, Dr. Nachim, can you tell me a little bit about, as much as we know now, there's different strains, there's, a focus on cannabinoid 1 or 2. Like, I imagine that you work with, that's the kind of specialty, the specialized knowledge that you have.
Sure.
So, like, tell us something about that for the viewers.
So choosing cannabis is a little bit like going to the LCBO. Since the new program's been started, we have 25 licensed producers that have been approved to grow and sell cannabis. There's about 250 strains available.
Really?
Or so, more coming out every day. So that range, it's a huge range, and according to Health Canada and what different licensed producers have to do in order to sell, is they have to do certain tests on their products. So it's quality tested. So they're tested for metals, for heavy metals, for bacteria, fungi, and as well, most importantly, they measure the THC and CBD levels of the plant. So the THC, it ranges from less than 1% to more than to about 30. That's where we're at, or so. In general, the more THC that we have in a plant, the more psychoactive and potentially harmful effects you can.
In other words, the more high the person gets.
Exactly.
Right.
But there's other components that go along with it as well. And the CBD can potentially counteract that. And there's other cannabinoids in the plant and other biologically active compounds that also determines the effect that the plant will have.
Would you be more inclined to prescribe medication that has less THC in it as a result?
Sure. I mean, as a general rule, we typically start with especially if the cannabis naive patients, we start the lowest potency, so the lowest THC, and we don't have enough evidence, enough knowledge to know which strains are going to work for certain conditions. That kind of information doesn't exist yet.
Yes, that's what we're looking into.
Exactly. Yeah. So we always start on the safety. We always think about safety first. So we always encourage patients to use the lowest potency and the lowest amount possible that will control their symptoms in order to increase function.
And I mean, I've heard you speak in the past, and I recall one of the issues was that you could write a prescription, low THC and maybe high cannabinoid 2, or I'm not
CBD,
sure.
Yeah,
yeah, it's a CBD. But it would be really difficult to actually find that prescription, a match for that prescription out there that's being produced. Has that changed at all?
Yeah, so actually, over the past year, since the new regulations for accessing herbal cannabis have come into existence in Canada, there's been an explosion in the number of licensed producers that are selling product at the moment. And now we have many producers who are producing a variety of product. And it's much more common now to find product that is low in THC and high in CBD, which is the non-psychoactive component.
Right. And the medicinal component.
Now, we have to remember that just because THC makes you high, is the psychoactive component, doesn't mean that there is not any medical properties to it. It's an excellent analgesic. It's an excellent antispasmodic, so people who have spasms. It's excellent to help improve appetite and decrease nausea and vomiting, but it does have those side effects of anxiety, of paranoia, of being high. And it's interesting that when we ask our patients about why do you use cannabis, most often they tell us for two reasons. First off,
we got a caller, so do you want to finish that thought?
So they tell us, first off, it turns the volume down on the pain. It decreases the pain on a pain scale by a few points. But even more striking is it gets their mind off of the pain. And it basically distracts them from the pain so that they're able to do other things. They're able to enjoy time with their family or watch TV or go for a walk.
Okay, thank you. We have a caller. Joseph, would you like to give us your question, please?
Yes, my question for the doctor is, I'm very curious as to whether or not I would qualify to use cannabis as treatment for my depression, because right now I'm on 3 different very strong prescriptions of antidepressant medication, and I do use marijuana recreationally, but I was thinking of using it in more of a legal form now.
Yeah, so I mean, that raises the point, you were mentioning some of the physical conditions, so can you give your thoughts about that, but also just to talk a little bit about some of the mental health issues, or
So I think for psychiatric conditions, we're always a little bit more careful, and that's because there is a significant number of studies done over the years that show an association between certain psychiatric conditioning being worsened when the patient is using cannabis. So we're always a little bit careful, and although a lot of patients do report improvement in symptoms, we know that, you know, sometimes with depression, symptoms can worsen when someone starts using cannabis regularly, especially the more potent THC. However, some patients will report improvement in symptoms.
what about it for depression, for Joseph? Would that be a helpful thing?
So sometimes what we do, you know, and a lot of times, you know, I think it's important to understand that cannabis as a treatment is not an accepted treatment for depression as it stands in any of the guidelines. However, we do have patients who are referred by psychiatrists, and that's what I would suggest is, you know, speak to your psychiatrist if you have one, or your family doctor, and have that discussion with them, because if you really looked at other options and nothing's working for you, we have in the past in certain cases worked with patients who have found benefit. Perhaps they've tried a recreation and they found that it helped, and we can try certain cannabinoids, and it doesn't have to be the plant. It could be nabalone, sometimes Sativex, and sometimes the plant, and we can, especially in CBD, the CBD component of the plant has been shown to have anti-anxiety and potentially antidepressant effects as well. So it is a potential treatment.
Did you want to add something to that?
No, it's exactly as Dr. Nachim was mentioning, is that we have to assess the patient individually. It's hard to give a blanket statement to say that cannabis is good for depression or good for anxiety.
Because it could make it worse.
It can definitely make it worse.
Yes.
We see in many patients who start using cannabis on a regular basis that their anxiety gets worse, their paranoia gets worse, and they end up using more and more.
So how do you figure it out?
Through a very good history.
Okay, so for somebody like Joseph who's saying Joseph, are you still there?
Yes, I'm right here.
Did you, when you did smoke it recreationally, did you find it helpful for your depression? I mean, I guess that's one of the questions you'd ask.
That's
right. Usually I do both. I do the medication in the morning, usually followed by marijuana, sporadically throughout times of the day, like every 2 to 3 hours.
So you've already been doing it anyway, and have you found it helpful for your depression?
Yes, I have.
Okay.
So for yourself, one of the first things we'd like to do is first know how much you use. How many grams, if I'm asked, Joseph, do you use a day?
About 1.
1 gram a day? Okay.
Yep.
So the first step would be to consider something like nabalone instead of cannabis, of the plant, to see if you get any improvement in symptoms. And as I said, you know, have that discussion with your psychiatrist and family doctor, and if they feel it's appropriate after you guys have that discussion, is to, you know, be referred to a clinic for further assessment and discussion.
Right, like he could actually speak with one of you.
Absolutely.
Yeah. I just let me ask you, since you mentioned about other psychiatric conditions, something like bipolar disorder, which is so common in the addictive realm. What would you be inclined to pursue that cannabis or not?
You know, again, with any of the more purely psychiatric illnesses, we really do want to ensure that they have appropriate psychiatric follow-up, and that they've been appropriately managed up until the point that we've seen them. And ideally, it would be their psychiatrist who would refer them to our clinic and to be evaluated by one of the physicians.
Right.
With bipolar, there's always
bipolar 2, I mean.
Bipolar 2. There's always an issue, because often they've been self-medicating with herbal cannabis for many years before seeing us, and we don't know if this has been contributing to their problem or has been helping them manage their symptoms.
Yes.
There's a number of questions that we ask in order to try to figure that out. One of them is, how long have you been using it? But also, what's the longest you've gone over the past year without using herbal cannabis, and what were the effects? What were your symptoms like? And we can try to tease out whether the symptoms that they're experiencing are withdrawal symptoms from the cannabis, or if they're resurgence of, or if they're symptoms of bipolar that are poorly controlled coming out a bit more.
Yeah, so you can see there's a lot of overlap that you have to tease out.
But for some people, especially in smaller amounts, it can actually be quite helpful. And we also want to make sure that when we're doing our interview and we're trying to understand why and how they're using it, we want to make sure that they're using it as a tool and they're not using it as a crutch. We want to make sure that it's a tool in order for them to be able to accomplish something. Sometimes people with bipolar or borderline personality disorder tend to get very agitated and aggressive and anxious very easily. Sometimes if they use cannabis on occasion, a few times a week, a couple of puffs, to stop and calm those symptoms down, that would be an appropriate way to use it. If they're using it first thing in the morning and every 2 or 3 hours, we have to figure out whether they're just treating their own cannabis withdrawal symptoms, or if they're actually treating their underlying disease.
Or what about if they're treating now with, if Joseph walked into my office, I'm an addictions doctor, I would be thinking this man may well be addicted to cannabis. So how do you tell the difference? How do you ferret out this is an addiction versus
we have
self-medication?
The same criteria that you use, and we go through. There's symptoms of addiction, we call it cannabis use disorder. So we have the 11 criteria, and we go through them and whether they meet that criteria or not, and we put that together with their history and then we try to come up with an assessment. And a lot of times they have multiple things going on, and it's not so simple. It's not an addiction or simply a pain condition or simply depression. A lot of times it's all three together. So we deal with a very complex and difficult population, and I think we've made our mistakes. But I think overall, patients do, we try to help as many patients as we can, and sometimes we can't help everybody.
What about if you determine that it is an addiction? Would that be, you mentioned in the preliminaries about being a harm reduction, using a harm reduction model. Do you see that if this is possibly a way to self-medicate, that it's better than alcohol or cocaine?
And I think, so that's a difficult question because there are harms associated with each substance.
Yes.
But I think that if you look in the how you treat addicted patients yourselves, and that the treatments for cannabis are very limited as of today. Essentially, we have different kinds of therapy groups and support groups, but there's no real good pharmacotherapy or medications that we can give them to help with addiction.
Right.
So we're, and that's one of the things that we're sort of working at and trying to, learn and do potentially research is to try to figure out, can we give other medications to help them get off cannabis? And one of the options that we've started looking at is putting them on cannabis, because we have a unique opportunity in Canada where we have access to cannabis for which we know the contents of the THC and the CBD.
Yes.
And we've been able to take patients who are high dose users, who are using 5 grams a day, 7 grams a day, and be able to taper them down to a much lower dose, to non-daily use, and be able to get
like a tapering withdrawal.
As a tapering mechanism.
So but what about if they're addicted? Is that okay? Because they may have a chronic pain condition as well.
Well, so we look at, and this is we treat the comprehensive patient. So we will treat both their addiction and their pain. Usually, you cannot treat their pain unless you control their addiction first. Like with opiates, it's the same.
Right.
Once you get a hold of their addiction, then we can deal with the pain.
Okay.
And usually also.
And we do quite a bit of education with our patients about the distinction between tolerance and dependency, as well as with addiction.
Right. We have a caller, so let's go to our caller and then we can come back to that. Mary, you have a question for us. Why don't you ask one of the doctors?
Yeah, I'm just wondering, you were talking about depression, anxiety, and I'm wondering if it's the effect of the drug or if it's the effect of inhaling and exhaling, because we found that when people are trying to quit cigarettes, certainly they talk about cigarettes, calming them down. When we switch them to smoke or inhaling through an empty straw, they get the same effect. So is that what we're looking at as opposed to the cannabinoid?
So that's an excellent point, actually. And one of the things that we see often is patients come to us already using herbal cannabis, but they also smoke tobacco. And we ask them, okay, just like every other doctor annoys their patients, so when are you going to quit tobacco? When are you going to quit smoking? Okay, I'm going to quit, I'm going to cut down, I'm going to cut down. But what we see is that they start mixing tobacco into their cannabis joints, and they start smoking more and more. And they're just replacing one with the other. So we try to get away from smoking entirely. First off, we are always recommending against smoking and talk about vaporization, which is, we believe, a much safer way of consuming herbal cannabis.
Why don't you just define for the viewers what vaporization
So
is?
vaporization is a way of inhaling herbal cannabis without actually inhaling smoke. A vaporizer is a machine that allows you to heat up the cannabis, and cannabis, just like all living things, is mostly made up of water, and it heats it up to a point where the plant material does not burn, but it gets hot enough so that the water inside of the plant gets steamed off or turned into vapor. That's why it's called a vaporizer. And what you do is you inhale the steam or the vapor along with the active ingredients, the THC and the CBD, as well as all the other cannabinoids. And what I found, I was speaking with a patient today actually, and I was bothering him because he was still smoking joints and not using his vaporizer as much as he should. And what he told me was that, Doc, it's the ritual around rolling a joint that really calms me down. It's breaking up the marijuana, it's putting it into a cigarette, it's rolling it up.
Dr. Neem, do you want to add your 2 cents for Mary? And then we have a caller we have to get to Tony.
I think the psychological component of addiction is always, or of any drug really, is always a tricky one to break. And even with people who are addicted to opiates, even once we control their physical symptoms, they still have the psychological component. And I'm guessing that's, maybe that's what happens with the smoking. I'm not really sure about the straw, and I hadn't heard of that before, but it's quite interesting. With cannabis, I think the potential addiction aspect of it is lower. People, they don't have the same craving that they do to cigarettes or to opiates as they do with cannabis.
Okay. Well, thank you, Mary, for your call. And Tony, why don't you give us your question?
Hi. Yes. Thank you for taking my call. I have a question regarding some rare conditions. I suffer from relapsing polychondritis with ankylosing spondylitis, and the combination seems to be extremely rare. And I've seen many doctors, specialists, and they're all having trouble because the combination is quite rare. And I'm wondering if the doctors have had any experience with using medical marijuana in situations where the disease is rare and there's not much literature or knowledge on it.
Right.
And, my condition really affects my trachea, lungs, cartilage disorder, basically. So do you think I might be a candidate to try medical marijuana?
Well, thanks, Tony. I think it's interesting. You've got to be specialists not just in cannabis, but also in chronic pain syndromes.
Exactly.
Are you aware of the condition that Tony's talking about?
Absolutely. It's absolutely fascinating, and thank you for calling in, Tony. First off, we would love to see you at our clinic and assess you and discuss about the possibility of helping to treat your symptoms with cannabinoids or herbal cannabis. And to go more to your point, as opposed about being specialists in everything, I don't think I've learned as much in medicine since I've been working at the Cannabinoid Medical Clinic, because patients come to us with all sorts of various conditions that often I haven't heard about, and I'll have to read about the day before I see them.
We're a magnet for rare conditions. I think this is Unfortunately, we are our last resort clinic, and again, it goes back to your question: is how do we know, who are the, our patients coming for recreational use? No, we get a lot of patients like Tony coming in who they've tried everything. They've gone to see 5, 10 different specialists. They've gone to the U.S., to different countries, and they can't find a cure or help really for their symptoms. Now, we always tell patients we can't cure you, but we can help relieve some of the pain and improve your function a little bit. Not all of it, but a little bit.
And this is something else that I think we really have to make clear, is that herbal cannabis is not a cure. It is one more medication or therapy that we can use to help treat and control your condition, but it won't cure ankylosing spondylitis, it won't cure cancer, it won't cure seizures, but it may help control them.
Or it may help, I think you were saying, not so much ignore it, but somehow be distracted.
Get your mind off of it.
So that you can move on with your life.
That's it. And that's, for me, one of the most striking things that I hear from patients.
So, Tony, if he is interested, just needs to call your clinic and then he can
and we'll explain how to get a referral from your physician or specialist.
Thank you for taking my call.
Yeah, thanks a lot,
Thanks for
Tony.
calling.
Yeah, and anybody else who has a call who has experience with using marijuana medicinally or is curious about it, please, we encourage you to call in. So anyway, where were we before that? I was asked, I guess one of the things I'm really struck by is that the popular view would be it's the 21-year-old who is just wanting the legit prescription, but you're in fact not getting that at all.
No, our average patient population is 50.
Now, 50, wow. Do you ever turn people away? Just say, no, this is not appropriate. Like, who would be not appropriate?
We'll assess the patient. I think, it's if they're referred, by a different doctor or the patient at least has requested an assessment. And I think it's, they're as proper medical care, it's we need to assess them. If they're not, candidates for cannabis or cannabinoids or any other sort of therapy, we'll inform them. And we'll also provide guidance as well in what they can do.
What are some of the side effects that you have to caution them about, patients about?
So the most common side effects for cannabis, any cannabinoids really, is the 3Ds. So the dizziness, the drowsiness, and dry mouth. Those are the common ones. Once you go higher on the THC, you start to get the side effects of being high, and psychoactive effects and cognitive side effects. And then you can get changes in your heart rate and blood pressure.
Like high blood pressure?
High or low. Some patients can also can drop. You can get people can get all, especially the distortion in space and time, really. A lot of patients can get a bit confused by that. But all these are transient. I think the one thing that,
Sorry, all these are
transient, so they're temporary.
They go away?
They go away while they're under the effect of the cannabis or the cannabinoids.
Oh, I see, while they're under the effect of it.
Exactly. And then once the effect wears out, and that's why sometimes we prefer them to start off vaporization, especially if they're not experienced with cannabis, because that effect will only last 2 to 3 hours if they do get an adverse effect.
Oh, I see.
Many patients come to us and say, Doc, I really don't want to inhale, I don't want to smoke. Can I just eat it?
Yes.
And we tell them that if you haven't used cannabis before, it's really not a great idea to eat cannabis.
Because it stays in your system for so long.
Exactly. So often what happens is a patient will eat a cookie or a brownie. Nothing's happening. May as well take another one. And then 2 hours later, the effects have hit them, and it's often extremely unpleasant. And when you ingest it, it also lasts a lot longer than if you were to inhale it. Now, when you're inhaling, you can inhale and what we call titrate 1 puff at a time. So you can take 1 puff, you can put it down, you can wait half an hour, and you can evaluate your symptoms. And if your symptoms are not well controlled and you're tolerating the medication well, you can take another puff. And that way they can really dose the medication or titrate the medication to the desired effect without getting the unwanted side effects.
Can you give me a typical dose?
Sure.
Because one of the things that I hear from the medical is that it should be 1 or 2 puffs a day, whereas people we know are smoking joints a day. And we have a caller, so if you can just do that one short.
First, I want to let you know that most people who use cannabis medically probably use a lot less than those who use it recreationally. Most of our patients who use it medically will use under 1 gram a day, and the THC is often less than 12%.
Okay, and like how many puffs or
And
joints?
they'll use about half of a joint, if I'm going to use joints,
Yeah.
or 1 vaporizer bowl, maybe 3 times a day, depending on
Okay.
what they're doing during the day.
Good, thank you. Shannon, you have a call for us.
Hi, yes, I do.
Welcome.
So I have a question for the doctors. I've been diagnosed with a skin condition called hidradenitis, and I also have some back issues as well. I've probably gone through about 100 surgeries in the last 10 years.
Wow.
And I was prescribed opiates, specifically Percocet, for my pain, which actually turned into an addiction, which I've come through now. I'm not a marijuana user at all. A few times in the past I've used edibles, which has helped significantly with the pain in my body. My question is, would someone like me be a candidate for medical marijuana? And also, my fear is I don't want to be high. So that's my question, basically.
So can I just ask you, have you been treated for the opioid addiction already? Is that still
Yes.
ongoing?
Are you still taking the opiates?
I'm absolutely not. I was on Suboxone, and now I'm off of Suboxone.
Okay, great. Good. You know, you're definitely at a higher risk to becoming addicted to cannabis as well. The addiction rate is much lower. However, from our experience, a lot of patients who have a previous history of opioid use disorder, they tend to have more insight. They understand what addiction is. You know, the challenge that we have with a lot of patients who are addicted to cannabis is they don't understand what a cannabis addiction is. Whereas someone who's been there and they've gone through an opiate addiction, they know, they understand it. So, you know, I think what we do is we keep a very close eye on the patient. We start at a very low dose, low potency, and we control, and we see you regularly, and we try to, you know, just give you enough that helps with your pain, to help with your pain without giving you the psychoactive or the side effects or making you feeling high. And it tends to work for a good amount of patients. Again, there's always that small chance of becoming dependent, but we sort of control for that. And that's why we see patients regularly. And the way it should be done by all doctors, really prescribing cannabinoids in this area.
Did you want to add something?
Yeah, there's growing evidence as well of using cannabis in order to help reduce opioid and alcohol dependency and abuse. This is a growing field and a growing area of research that is incredibly interesting. And I think also in our own practice, we find that people whose drug of choice might be cocaine or alcohol or opioids may not have the same affinity towards cannabis that they would towards those other drugs of choice.
That's true. They often say, I used to smoke it, but I don't anymore.
Exactly.
We have another caller. Johnny, do you want to ask us a question, please?
Yes, thanks for taking the call.
Thank you.
I'm calling regarding, I have some of the symptoms that have been mentioned on the program already. I have some depression, anxiety, and occasionally pain medicine for bursitis I have in my hip. I've been on my feet all my life. I'm in my 50s in the restaurant business. Now, I used to be a pothead, truly a pothead, up till maybe 10 years ago. I'm curious now, if I were to go on a program, how would it affect me, my sexual function? And if I'd like to have another child, how would it affect my sperm, so to say?
Yeah, good question. Either of you like to take that?
So I think based on your history, if you know, and I'm not sure what you mean by a pothead. If it really means that you're addicted to cannabis, you're definitely at sort of a higher risk of complications from trying cannabinoids again. But if it was simply a phase in your life where you're using more and you're more of a habitual user, then I think it might be worthwhile revisiting. In terms of your sexual function, there are some studies that show a decrease in the sperm count or the quality of sperms, well, at least while you're under the effect of cannabinoids. So, I think if you're thinking about having a child, you shouldn't be taking any drugs, whether it's alcohol or cigarettes or cannabis, anything. It's probably the best and safest method. As far as I know, all these changes are temporary. But that would be my suggestion. I don't know if you have anything to
no,
add,
exactly. It's always a good idea to be off of any drugs if they're not necessary for hopefully at least 3 months. Allow it to get out of your system. And chronic cannabis use can decrease your libido or your sex drive, as well as potentially alter your sperm while you're using it.
But what about? I mean, that's sort of one of the classic cliches about cannabis use is that it decreases sex drive, it decreases just drive in general, motivation in general. How can you? What do you say about that?
So
sort of
chronic
syndrome.
Habitual or recreational users may experience, what is commonly called amotivational syndrome. But it's more a constellation of symptoms, and it's probably more closely described as cannabis use disorder. Patients who are truly medical users of cannabis actually see an incredible increase in their ability to function, an increase in the amount of things that
so that's almost a way to distinguish.
Exactly, and it, so if whenever we see a patient, we always say, okay, we're going to be giving you a medication, but what is it that you want to achieve by using this medication? And often patients will be in so much pain that they're unable to spend quality time with their family. So they'll say, Doc, I want to use this medication so I can go out with my family.
I have to interrupt you. This is a fascinating conversation. We'll be right back after the break with more help on Toronto Speaks Addiction. Welcome back to Toronto Speaks Addiction. Today we're discussing and taking your questions on medical marijuana. Okay, so we have another caller. The phones are lit up. Eris, do you want to give us a question, please?
Yes, hi.
Hi, Eris.
Yeah, I have a question. I have a mental illness, and on top of that, I have an undiagnosed case of complex PTSD. And I get these flashbacks that are just horrible. And during the flashback, I get nauseous and I start breathing heavily. I mean, it's not a panic attack because it's different, but they're just horrible. And I have to take a lot of sleeping pills to get rid of the flashback, but I can't keep taking sleeping pills because it's not good for my liver.
Okay.
So
Eris, you're asking if medical marijuana would be an appropriate option for you?
Yeah, I asked my family doctor that if I qualify for it, but he said that
let's ask the physicians. What would you say, given a complex post-traumatic stress disorder, history of other kinds of medical issues, mental health issues? What would you say?
So definitely there could be a role for medical cannabis in your condition. What I heard though was that you said it was undiagnosed PTSD.
I heard that too.
And that concerns me. If it's not diagnosed, it means that you haven't received the care that you deserve and that you need. And you need an assessment by potentially a psychiatrist and potential other treatments aside from cannabis. Maybe you need some counseling, trauma counseling, maybe some different types of medications, anxiety medications. So, the first step is to ask your doctor for help for these other conditions. Once that has been properly teased out,
Right.
then we can assess whether you may be a candidate for herbal cannabis.
Okay, so for Eris, I think we would first of all say he should seek psychiatric care and then get a
Absolutely.
referral to you. Now, I want to make sure we get the question out about work, because if medical marijuana is well, it has been. It's now being prescribed. What's your opinion about, should a person tell their boss that they're on medical marijuana, and if so, are there particular jobs that where they have to and versus not?
So I think that it's very important to determine whether someone is in a safety-sensitive position or not, because
Okay.
that makes a huge difference.
Like a subway driver, or
A subway
pilot.
driver, exactly. Anyone operating any kind of heavy machinery in jobs that may compromise your safety or other people's safety, that's absolute priority. And
Yes.
most companies should have some kind of policy, workplace policy for drug use.
Yes.
And even if it is medically prescribed, just like they do with opioids, they should inform their employers. And then they can then decide if they should be continued to work in that position or not.
Okay.
For positions that are not safety sensitive, it becomes a little bit trickier. And I think
What about a nurse or a doctor?
so
Are they safety sensitive?
well,
Actually,
I think there's a lot of it. It's not considered safety sensitive, but it definitely can impair judgment. We know that from previous trials that they've done with pilots, the effects of cannabis can linger up to 24 hours after use. So I think and it also depends on how much they're using and how the potency. So there's many factors there. And I think if anyone is using that should be as a policy, they should disclose to the employers. And there are companies that, one of my other jobs that I do is I do assess patients who have used cannabis at work, and their companies will ask them to be assessed
Yes.
by an independent doctor to determine whether it's appropriate treatment.
Thank you. We have another caller. Joanne, would you like to give us your call or your question?
Hello?
Hi, Joanne.
Yes, speaking.
Oh, beautiful. Do you want to give us your question, please?
Yes, I just want to know. It's been 4 years that I'm suffering of chronic pains in my upper neck and shoulder, and they're telling me that it's either inflammation of my inflammation or like wear and tear. As you know, I work in an office. I was wondering if this kind of medication will help with the symptoms.
Do one of you
So again, it may absolutely help with the symptoms. It's impossible to know until we try it, just like any other medication. And just like any other medication, we approach it in a stepwise fashion. So speak to your doctor about your pain. Hopefully they'll address that, give you some medications to try, maybe physiotherapy, acupuncture, chiropractic, and other treatments. Potentially a referral to a pain clinic, and if that fails, of course, we would always consider cannabinoids as a therapeutic class.
So you're saying for Joanne that it's a good possibility, but she needs to pursue.
Yes.
Yeah. Okay. Good. Great. I have another question that I really want to make sure that we address, and that's the whole issue about driving. Should a person who is doing their 3 vaporized bowls a day be driving a car? You yourself mentioned it can impair
definitely
judgment.
there is psychoactive impairment, and even with a lot of patients will say, well, they don't feel high, or they're using low THC, high CBD strains. But nevertheless, we do ask patients not to drive for 4 to 6 hours after they consume cannabis.
Okay.
And this is because we don't have enough information about impairment and the effects of cannabis use. So 4 to 6 hours after using cannabis, inhaled. Even longer after oral ingestion. It can be up to 12 hours or sometimes longer, as long as they're feeling high.
Yeah. Okay. So I guess that's okay. So is there anything else that you want to add? We've got just a couple of, 20, 30 seconds left that you want viewers to know about.
Basically, if you think that cannabis might be an option for you, please speak to your doctor about it. Most doctors are at least willing to hear your concerns, and if they're not comfortable, ask them to be referred to a physician who does have more knowledge and is a specialist in cannabinoid therapy.
Yes. Did you want to add something?
Yeah, I think cannabis and cannabinoids is just one of the tools. It is, a hot topic right now. You're hearing about it every day in the news, and we are heading probably towards legalization as a society, which we haven't had time to discuss.
I know. As a matter of fact, we got about 20 seconds. Do you want to say something about that? Like, is this just the first step towards legalization?
And I think we're going to see a big shift in society. We were talking about pain and different, ways of medical cannabis, but I think, this topic is going to become more and more of an issue as we move forward, and we're going to have to, especially as physicians, to figure out ways to deal with different situations, and that's what we're trying to do.
And we're going to need a lot of push
I want to say thank you very much. I have to interrupt you. This was a great conversation. Well, we are out of time. I'd like to thank our guests, Dr. Ilan Nachim and Dr. Daniel Schecter. And I'd like to thank all of our callers who braved the phones. We'll be back next month with more Toronto Speaks Addiction. Thanks for watching.